Good afternoon, everybody, and welcome to our webinar with the General Medical Council. My name is Michelle Pooley, and I'm a Programme Manager in the Medical Pay and Workforce team here at NHS Employers. I'm also joined by my colleague Corinne Banham in the background, who will be monitoring the Q&A chat for us today. So this afternoon, the GMC's Insight team will share its most up-to-date analysis of the SAS workforce, looking at who they are, what they're doing, and how they're doing. The findings are shared from the analysis of the state of the medical education and practice in the UK publication. So just a couple of housekeeping rules before we begin. Please ensure that your microphone is muted throughout unless invited by the chair to speak. Please type any questions you have for the speakers into the Q&A box and we'll address these towards the end. And just so you know that the webinar will be recorded and a link to the recording will be shared afterwards. We'll also be saving this onto our website for you to access at a later date or share with colleagues. So I'd now like to introduce you to James and Dean from the GMC's Insight team, who are going to be discussing the data with you this afternoon.
Thanks very much, Michelle. My name is James Gooding. I'm a Principal Data Modeller at the GMC. And we're going to be talking today predominantly about the findings from two reports, as Michelle was introducing there, that together form the state of medical education and practice in the UK report. So we're going to start with some data about the workforce, the hard numbers that we see in our data, and some efforts we've been making to better understand SAS doctors and locally employed doctors, LE doctors. And then we're going to move on, and Dean, who's joining me as a data and insight analyst, is going to be talking about the workplace experiences of SAS and LE doctors. We're hoping we can get into the discussion in the second half of the presentation, and we'll try not to spend too much time just talking at you. So, workforce data about SAS doctors. And historically, you'll be aware that we've grouped SAS and LE doctors due to limitations in our own data systems. That group accounted for almost a quarter of the UK's licensed doctors in 2022, and it's the fastest growing group in the workforce. So there's various reasons that we've needed to really try and improve the way that we establish how to group doctors. It's never been ideal. We know that it comprises a broad variety of doctors. There can be those that have just joined from abroad, those that are in their early career, perhaps taking a break after the second foundation training stage, or are moving away from formal postgraduate training altogether. It can also include doctors that have built up many years' experience in one specialty area, but then also a wide range of other roles might have been taken on by these doctors. They might have worked in leadership roles and education and clinical supervision roles. So we have been quite aware that the SAS and LE doctors group is not ideal. And so we've used NHS contracts data in England and Wales, where we currently have the data, to better define the roles of doctors in the SAS and LE group. We've used quite a body of research to define the two groups. There's just a list here of a few of the grades, which encompasses discontinued roles as well, that we use to define SAS doctors. So associate specialist, specialist doctor, specialty doctor, staff grade. What's interesting for us as the GMC is to see the numbers of doctors that are consultant contracts, but not on our specialist register. It's probably quite niche interest, probably more interesting to people that manage registers like we do. But this reflects the freedom that foundation trusts have to define the job titles and job roles in the contracts they have there. We then group up all other interpretable roles for doctors as locally employed roles, and that can include fellows grades and various others. And just to say again that we're really looking into how to expand the coverage of the method to Scotland and Northern Ireland, given our remit is the whole of the UK. So when we've looked through the NHS contracts data for doctors that we've grouped into the SAS and LE register group, we produced the chart on the right of the slide there, and immediately you can see that there's quite a difference in recent trajectories with the blue line for the SAS doctors growing at a similar rate to the specialist register. So from 2014 to 2021, there was a 19% increase in the number of SAS doctors. And that's similar to specialists that were 21% and considerably larger than GPs. That type of growth is completely dwarfed by the growth of locally employed doctors that have more than doubled since 2014 in England and Wales. And this has shifted the balance. And yeah, apologies, I can just see there's a question on LE doctors. So that's locally employed doctors. And this has shifted the balance of the SAS and LE doctors group in England and Wales, so that LE doctors have become by some margin the largest component of the SAS and LE group. And this is really important for us to understand as the GMC, because we've previously been talking about SAS and LE group together being the largest and the fastest growing group, when really it is being driven by the locally employed side. And that can reflect all kinds of different kind of developments in the workplaces themselves and in wards. So perhaps when we get into the discussion, we'd quite like to hear how you see this manifest, and if your experiences of different teams that are starting to see more locally employed roles. And when we split them using their NHS contracts, it does pull through the expected differences that we had previously heard from anecdotal research. So 82% of SAS doctors had been licensed for 5 years or more. They're more experienced, and only 35% of those that hold LE contracts have been here in the UK practicing at the time. This makes the SAS side more comparable to the GP and specialist register, and the LE group stands out in another way as well of having that lower experience. And then when we look at non-UK graduates, SAS doctors have a much higher proportion than any other register group. So there's some key differences in the trajectories of the workforces of SAS and LE doctors. There's also key differences in the demographics. And I'm now going to pass you on to Dean, who's going to talk through the differences in their workplace experiences.
Thanks, James. So I was just reading in the chat and then had to request control, and I'm not a good multitasker at the best of times. So yeah, following on from James talking about the workforce numbers and trends, I'm going to talk to you a bit about what we know about, what we've learned about SAS doctors' workplace experiences from our barometer survey that we conduct annually. So I'll be talking mostly about the results from our most recent survey last year in 2022, and going back to when we started the barometer in 2019 to tell you about some of the tracking we've done. And yeah, I'll tell you about the publication that we've got today of further analysis of the workplace experiences. So firstly, just on what the barometer survey is, this is a survey that we commissioned and delivered independently, and it's intended to be representative of the population of doctors in the UK. We started doing it in 2019, and we track doctors' experiences on a range of measures, so things like satisfaction, risk of burnout, their future intentions, difficulty with patient care, so things of that nature, and we report on them in SOMEP. And actually, I should perhaps mention that the latest barometer survey is live at the moment, so we would encourage everyone to participate in that. It's really valuable to get everyone as many views as possible. So changes that we made in 2022 is that we included a new question on doctors' contracted role, and then we used that to separate out SAS and LE doctors from one another. And yeah, as James sort of alluded to, for a while we sort of reported on SAS and LE doctors together, which we're well aware isn't an accurate way. So we added this new question, and that let us separate SAS and LE doctors in the barometer survey for the first time. So that's been really valuable. So in future, in the 2023 SOMEP report, we were able to separate them, and in future we'll be able to track them separately. But looking backwards, we can only track SAS and LE doctors together as a single group. So first of all, I'll tell you a bit about the SAS and LE group that we've been able to track over the years, and then we'll get into what we can say about SAS doctors as a separate group. So in general, experiences across the board of all types of doctors worsened from 2021 to 2022. And it's actually the worst levels that we've seen since we started the barometer in 2019 for measures such as doctors having a high risk of burnout, which we measure by asking a range of questions of burnout indicators, and then adding those together. Having regular difficulty, so I think that's once a week or more, having difficulty providing sufficient care to a patient, and having taken hard steps to leave the profession in the UK, which was where they tell us they're likely to leave, and then they've done things that we consider hard steps, such as talking to a recruiter. So they've not only told us they're going to leave, they've taken a concrete step towards doing so. So I'll be talking through these points, so I'm just going to move on to the next slide. So these are just sort of illustrative examples of the kind of things we've seen. I think the numbers maybe the years maybe cut off the bottom, but this is showing 2019 to 2022 satisfaction. So you can see in 2019, the first point there, grouped together around the 70% satisfaction mark, with GPs very low at 50%. Then we saw sort of convergence in the next year before it spread out again in 2021, and then what we've seen last year in 2022 is a decrease across the board to the lower levels than we saw in 2019. So it's sort of a mixed picture for the SAS and LE group. You can see there the satisfaction is higher proportion of SAS and LE were telling us they were satisfied than other groups, but it's still fewer than were telling us they were satisfied in 2019, and it's dropped to just under 60% there. So a bit of a mixed picture in terms of satisfaction. And then this is increase in difficulty providing sufficient patient care. So once a week or more by registration type. So all doctors, it increased from 25% saying that had difficulty once a week or more, up to 44% in 2022. And again, increases across the board. And another mixed picture for SAS and LE doctors. So in 2022, they've still got the lowest proportion at 30% of the different types saying that they'd had this difficulty, but it is one of the biggest increases. So up from 9% in 2021, so about a 20 percentage point increase, and about a tripling in the proportion. So one of the biggest increases. So yeah, sort of a mixed bag again, and sort of difficult to interpret that. These were the main findings that we included in the workplace experiences report about SAS doctors as a separate group, so no longer grouped together with LE doctors. And for these first main findings, we looked at, as well as SAS doctors as a group, we grouped them by where they gained their primary medical qualification, whether that was within the UK or outside the UK. So non-UK PMQ includes both in Europe or internationally. So those are grouped together in this. So more SAS doctors were categorized as having a very low burnout risk. So that's 43% compared with just under a third of all doctors surveyed. And more were telling us they were satisfied in their work. So that was 63% compared with only a half of all doctors surveyed. So generally more satisfied according to the barometer. And when we looked at the groups by PMQ as well, SAS doctors with a non-UK PMQ more of them were telling us they were doing well, 44% compared with a quarter of all doctors. But on the other side, fewer were telling us that they had a supportive team. So 61%, so still a majority, but that was compared with almost 3/4 of doctors overall that felt their team was supportive. So it seems like there's a bit of a gap in terms of support for non-UK PMQ SAS doctors. Looking at SAS doctors with a UK PMQ, over a third said they had what we term a normalized heavy workload, which is where they are quite often working beyond their agreed contracted hours, but they still feel able to cope with their workload. So it's better than working beyond their hours and not feeling able to cope, but it's definitely still not ideal, and it could have sort of long-term impact on these doctors and on patient care. So it's definitely something we want to be aware of and tackle. The further analysis of the barometer survey results from last year has just been published today. So this is a paper called Spotlight on SAS Doctors and LE Doctors, Analysis of Barometer Survey 2022 Results. A very snappy title, I'm sure you'll agree. So this gives further details behind the main findings in the SOMEP Workplace Experiences 2023 that I've just talked about. And then it sort of goes beyond that to group SAS doctors and LE doctors separately still. So SAS doctors and LE doctors in separate groups, and then it groups them by where they gain their PMQ in the UK or outside the UK, and then also by how long they've been in UK practice. So these seem to us to be the two main sort of parameters that were useful to split SAS doctors and LE doctors by. So we went for 5 years in UK practice across the different groups. This seemed to be the best split to use consistently and give us the best numbers, because it was actually getting down to quite low numbers, over 100, under 100 in some cases. We like to report on 100 or more respondents from the barometer ideally, but we felt as long as we were careful and had caveats on, we could go under 100 in this case. So yeah, these are the two ways we grouped these doctors in this paper. And there are several sort of uses that we intend for this paper, so it's quite a lengthy and quite a data-heavy paper. So we've done a bit of a demographic analysis of the respondents to the barometer survey, SAS and LE doctors, and we've looked at their roles as well, what they told us about the roles and the work they were doing and how they were working. So that, I must emphasize, that is the sample of doctors. You can't scale it up to the overall population of the workforce. That would be the kind of information that James was talking about earlier, but we thought it would be useful to have a breakdown of the sample in the paper. And then there's a range of data tables that are sort of taken from the barometer tables that are available on our website, but they're in a bit more focusing in on different groups. And I've got an example of one of those later to show you. Oh, the next slide. Sorry, I moved it up and I forgot. So yeah, this is the kind of data table we've included in the paper. So no need to focus too much on the data in it, but it's just to give you a feel of the kind of thing we've included. So we've included the statistics for all doctors that responded to the barometer survey, and then for specialists and doctors in training, and then SAS doctors split by time in UK practice, and SAS doctors UK PMQ split by time in UK practice, and the same for those with a non-UK PMQ. We've omitted GPs because we felt that specialists and doctors in training were the most directly comparable, but the GP information and a range of other information is all available in the full barometer tables. So yeah, just briefly on what we found, some stuff on a lot of the findings on satisfaction and things were similar to the main findings, so I won't go into those. But on support and development and learning, we found a few differences. So 57% of SAS doctors with a non-UK PMQ were telling us they felt supported by their senior medical staff, and that compared with almost 3/4 of those with a UK PMQ and 63% of all doctors. So it seems to be that non-UK PMQ SAS doctors feel a bit less supported by their senior medical staff. That could be to do with the kind of roles they're doing and how qualified they are, but definitely something we want to be aware of and investigate more. Fewer SAS doctors that qualified outside the UK that have more time in UK practice felt that their team was supportive. So still over a half of doctors, SAS doctors with a non-UK PMQ and who've been in the UK for 5 years or more, 55% were telling us their team was supported, so over half. But that is compared with 67% of non-UK PMQ SAS doctors with less time in the UK and almost 80% of UK PMQ SAS doctors. So yeah, it seems to be that there's a slight concern that those teams are less supportive for those with non-UK PMQ and more time in the UK. And finally, more non-UK qualified SAS doctors with less than 5 years in the UK felt they didn't have enough access to development and learning. And obviously this is really important. We want SAS doctors to, it is still a learning role. They're not on the formal training pathway, but they need to be learning and developing as best as possible. 36% of those doctors were telling us they didn't have enough access, and that compared with a quarter of SAS doctors with a non-UK PMQ and with more time in UK practice, and 27% of all doctors. So that was an important finding, we felt. Apologies for the long-winded definitions. I hope it's getting across. It might be best to have a look at the report if you're interested, and get your head around those at your leisure. So yeah, that was for us. So we're really interested to hear any questions now and have a bit of a discussion. So I'll hand back to the organisers to facilitate that, I think. Thank you.
Thank you both. I hope that you all found that interesting and useful. I'm going to pass over to Corinne now, who is going to have a look at the Q&As for us.
Hi everybody, thank you for sending in some questions. So we're just going to run through and ask some of the ones that came through. So we've had a message from Michelle, which says, do we know how many LEDs are on the wrong contract and should possibly be employed on SAS contracts with national terms and conditions?
Well, the short answer to that is no. We wouldn't really know how to define the wrong contract. I think it might tie to a point that Ms. Mohammed's raising further down about how trusts are using LED contracts as well. So there, on Ms. Barr's question, it's why LEDs are growing exponentially, but SAS numbers continue to almost plateau. My concern is that trusts are abusing LED contracts rather than investing in LEDs to progress them to SAS contracts career progression. And at the GMC, we don't actually have the visibility to know what roles those doctors are actually taking on, and if they are doing the tasks that are expected of a SAS or a specialist qualified doctor. So it's something where we can only really tap into that level of intelligence if we're going to do in-depth surveys, in-depth interviews. And I think, Dean, on the workplace experiences report, we've been able to do that to a limited degree, but it hasn't tapped into those areas, I don't think, Dean.
Yeah, I think my take on that question would be, I certainly don't have an answer, but I think it's a really valuable insight for us to sort of take forward and maybe bear that in mind when we look at this year's survey results when they get them in, and we can look back as well and see if that's a sort of concern that's being raised by if there are LE doctors that are dissatisfied. We have open questions and open responses to those, and we can see if that's something that's coming up as a source of dissatisfaction. I think it's a really valuable point for us to look into.
Yeah, and just to add in as well, we do obviously have some anecdotal insights that come in from medical professionals that we consult throughout writing the state of medical education and practice. And these are similar things to the kind of concerns that they're raising too. We do see it in the data for locally employed contracts that the job titles and the job codes are changing and shifting, and sometimes they're bringing in that certain wording to the job titles that would seem to be trying to convey that it's a more senior locally employed kind of contract. So there's a little question that we don't have any evidence on to say, are they shaping these contracts to look like something they're not, and making kind of locally employed roles appear as SAS roles? There's an interesting point there, but we don't have anything concrete on it.
Thank you. So we've got a question from Victoria, which is about the barometer survey. And can we advise if a similar survey of data exists for junior doctors or doctors in training, spanning the journey from doctors in training to LED to SAS as their experience evolves? Or is there an independent separate to LED and SAS?
Yeah, thanks, Karina. I'll start us off with the first half of the answer. So we obviously have the national training surveys where we go and ask doctors in formal postgraduate training about their experiences in the workplace, and that has a very high completion rate amongst trainees. I've put a link to the landing page for that in the webinar chat. However, what that isn't doing is tracking doctors as they then move away from postgraduate training into locally employed or into SAS roles later on in their careers. We have done a survey of SAS doctors specifically, I think it was back in 2018, which I'll find another link for. I don't know, Dean, if there's anything beyond those that you want to come in on. I think perhaps our paper that explores what the barometer says about SAS and LE experiences might be the best we could do.
Yeah, just to mention, so the barometer does cover trainees, doctors in training, but I guess it tracks sort of like groups, but it doesn't track at the moment individual doctors as they go through a journey. So we can only sort of talk about a group as we take a sample and do a snapshot each year. Something that might be of interest is that in this paper that's out today. So I limited myself to talking about SAS doctors today, but there are the LE findings, and one of the most sort of striking things that I think from my perspective that came up was the group of LE doctors that are UK qualified and have, particularly those that have less time in UK practice, seemed to be telling us in the barometer last year that they were having a really hard time of it, basically. And that group will be the one that contains doctors that have, after training, have gone into doing LE positions. So I don't think we've got the things that James explained. I don't think we have something that exactly covers what the questioner wanted, but I think we are getting towards finding some insights there, and that was a really striking one, I thought, in the paper.
And just to come in yet again on that one, I think the workforce report for this year that we're hoping to publish in early November, it shows that we're still seeing that increasing tendency to take time away from training after second foundation stage. So doctors are taking, more doctors are taking longer away during that time from training. And whilst they're away from that type of training, they're typically fulfilling locally employed roles and contributing to the system in another way. And then we're also in this year's workforce report showing that it's not just after F2, but it's all training stages have started to take a bit longer. People are taking time away from certain training stages as well. And when they do this, it's typically to build up experience and to build up certain skills, to do research, to aid the system, it must be said. But it means that those specialty training stages take longer. So there's a few aspects to how doctors move through training and interact in different ways and have really a portfolio career that spans quite a lot of different roles.
Thank you. So we have a question from Lynn, who is a Scottish SAS, and she's wondering if we're planning on comparing the data for Scotland and Northern Ireland moving forwards.
Yeah, Dean, I think you'll be best to answer
that. Thank you, James. Yeah, it's difficult. So I'm talking in terms of the barometer survey, and we have a representative sample of doctors. I think it's about 4,000 we aim for, and it's representative of the UK as a whole. But once you start sort of chopping that down, it gets a bit difficult to talk about. So once we're looking at SAS doctors and LE doctors separately, then we're getting, to be honest, we just get down to too small numbers for Scotland and Northern Ireland to be able to talk in any meaningful way about the SAS and LE doctors there. So I think it's a constraint on the barometer data that we won't be able to go into the sort of 4 nations unless there's a different way we can use it. So it might be that if we want to go into that, when we do obviously want to know about what's going on in the different nations specifically, that might need sort of a tailored piece of work to do that, because we're constrained by the numbers we're getting in the barometer. There is actually a bit more of detail. Sorry, I feel like a bit of a broken record saying the paper that's out today, but it does actually have a bit more detail in the numbers that we have from the different nations. So it's sort of for information and just to sort of explain a bit why, as much as we'd like to look at the separate nations, our hands are a bit tied by the numbers in the survey, unfortunately.
And I've done that thing of, while Steve was talking, kind of looking back through some other materials, and it did stand out when we did the SAS and LE survey and published our findings in 2019, that there's a group in Scotland of experienced SAS doctors who are having a particularly good experience relative to other groups of SAS doctors. So the link for that one is the last link in the message pane that I shared, and it's quite interesting to see how certain groups stood out as having a better or worse time of it on both the SAS and also on the locally employed side.
So to follow on from that question, there is one saying, what are the next steps with the findings of the non-UK qualified SAS feeling unsupported for development and progression?
That's a good point, and our role at the GMC is kind of limited, and we can shine a light on things that our data and insights kind of tap us into. But at a certain point, we have to stop and say, this is where the system really should be focusing some attention. So I think that in both the workforce report and the workplace experiences report, we're making it really clear that there's been a big shift in the workforce, that the portfolio careers, the use of SAS grade and the use of LE grade are so much more commonplace than they've ever been before, and that we need to make sure there's a variety of fulfilling career paths available to everyone. There's also the point on retention that we can't afford, given current workplace stress and strains, given the high levels of dissatisfaction, we can't afford to lose doctors. And retention is a really vital thing for the UK's healthcare systems, particularly in this moment.
Thank you. So we have had a comment from a SAS doctor who says they've worked with SAS doctors long to know that a huge number don't engage with the surveys. So how confident are you that the numbers that are presented as the barometer survey are an accurate reflection of the entire workforce?
Yeah, so each year we look through the survey that and the responses that come back, and as it's in the field, we assess whether there's been a representative sample. And then there's a process to try and expand and reach doctors that haven't responded in as high numbers as we'd like. We do come to the conclusion of it being a representative sample by balancing it against the register and by assessing the appropriate weightings that have been applied. So I don't know, Dean, if there's more to add there, but there is a good sample size of SAS doctors at the UK level to make comparisons within.
Yeah, and I think we've sort of done better, increased the base sample size from moving to using the register as a source of the sample, and I believe that the SAS and LE group of doctors is one we've sort of tried to like oversample from to try and boost the responses as well. So yeah, we're doing everything we can, and I think in terms of the numbers, we believe it's representative. In terms of it, I mean, it's a valuable insight to know that there are a group of people that aren't engaging, but I'm not sure how. And I think maybe I would suppose that there's perhaps doctors from other groups if they're dissatisfied that they don't engage. So I think it's sort of beyond our view to say, but in terms of the numbers, I think we're confident it's representative, and that's as far as I suppose as far as we can go to a certain extent.
Thank you. So we have had we've had a few more questions as well. The growing numbers of LEDs, are they from IMGs or are they UK graduates? Is this a response to the current climate in the NHS or juniors not wanting or not able to enter training?
Yeah, I mean, doctors not wanting, not intending to enter training is something quite difficult to unpick from what we see. There's certainly an element of UK graduates taking longer away from training. However, the biggest boost to the locally employed population has been IMGs joining in ever greater numbers. Now, we have some data in the workforce report coming out later this year that shows that increasingly those doctors that joined from abroad into locally employed roles are now becoming better integrated and moving into postgraduate training, staying for longer in our system than they have before. So there are some encouraging signs, and I think especially in GP training, there's a lot of interest from IMGs that have joined as LEs. There is a counter argument, there's a counterpoint there that UK graduates are finding GP increasingly less attractive. And so there's a bit of a call in the workforce report to say that we need to focus attention on why it might be less attractive to UKs than it has been in the past.
Thank you. So another question is, are the GMC separating out their data on the Data Explorer on the register? Because the data was removed earlier in the year. Can the graphs be seen now for LED and SAS separately?
I think the answer is not yet. We do have a variety of other tools to provide the data. So there can be, if I provide a link to our most recent data tables, that will show how the data was. However, that would be the 31st of December 2022. So considerably out of date compared to GMC Data Explorer. I believe the issue is being resolved with the IS team that we have. So hopefully it won't be too long before there are numbers for SAS and LE group doctors back on Data Explorer.
Thank you. Are the GMC capturing data on gender disparities and on those that are taking time out of practice? When they come back, are this cohort coming back as SAS rather than returning to training? And do we collect data on why doctors are ending up in SAS roles?
Just starting at the end, I think there's a good point that we don't see it as ending up in SAS, and we're well aware that for many doctors, SAS is proactive choice. In terms of gender disparities, the workforce report is kind of a showcase for it, where we look through all the all the subspecialties, all the specialties, including the kind of training pipelines, and we are testing for gender disparities. There's obviously a classic one that I think everyone's aware of in surgery, of there being less than a quarter that are female. However, it can be in other specialties such as obstetrics and gynecology, where the vast majority are females. So we do look at gender disparities. The level of detail there of looking through the decisions that were made following paternity leave, for example, or following a career break, I don't believe that we've quite tapped into that, but it is an interesting thing to consider. There's a broader program of work at the GMC about fairer training cultures, and gender is a big part of that. We have an equality, diversity and inclusion program as well, where we're trying to see what it is that might be unfairness in the system, in training, in getting into medical school at the start. So there is a broad variety going on. It's perhaps something for us to take away, though, to consider how decisions are made on a return to work.
Thank you. So we have another question. A SAS doctor working as an educational and clinical supervisor cannot still sign off FY2 doctors' CREST forms to enable them to apply for an MSRA exam. Are there any comments or plans on this?
I'm afraid I'm not the best person to answer that. It's outside of my expertise, so it's something that we'd have to go away and come back with if we can note that one down.
Will the portfolio pathway help SAS doctors progress in their career differently to the CSER route?
We obviously have a big program to look at how the CSER pathway can be improved. It's not something I can actually comment on myself, and I'm sorry to give that blanket answer again, but perhaps I can take it away and speak to the people in the CSER reform team about exactly what's changing.
Thank you. So we've had a comment from the use of specialists as a term in the tables in the presentation. With the new SAS contract using the specialist grade, it could be potentially rather confusing. So which group do SAS who are already on the specialist register get grouped into now? Are they specialists or are they still SAS?
So our definition for SAS would mean that they are not on the specialist register. And we completely agree that our tables should say doctors on the specialist register. So apologies for that confusion.
Yeah, I think as well, just to say, as you obviously completely agree with that. I think the way we ask about it's a bit more in the barometer. It's a bit more self-identifying. So we ask doctors about their main role, and one of the options is on the specialist register, and then we ask about whether and another option is a role such as a SAS doctor. So I think that does give doctors scope to respond and say that their primary role is, they view their primary role as being a SAS doctor or an LE doctor, but they could still be on the specialist register. So there's a bit of maybe a subtle difference of the data from the barometer, and therefore the tables on the barometer that are presented. But the initial point is absolutely correct, and we need to be really clear with labeling and nomenclature on our materials.
Thank you. We've been asked whether there's any SAS support strategy for learning and development needs.
Yeah, I think that we're making a general call in the state of medical education and practice to say that there must be fulfilling career paths in a broad range of routes that doctors are now taking. In terms of support specific for SAS doctors, I think that's something where I can check in with our education directorate, and we can come back with an answer for that one.
Thank you. I just want to ask Michelle if there's any more questions in the chat that can be answered on this webinar.
I can see that there's a few contractual questions, and I think our main focus for today was to discuss the GMC's data. So by all means, we will be answering those questions though, and I can provide, or we can provide, a Q&A page and send out to all attendees afterwards with any relevant links. So I think that brings us to a close then. So thank you all very much for attending the webinar this afternoon, and we hope that you found it useful. As you may be aware, the webinar forms part of SAS Week, which is celebrating and showcasing SAS doctors across the country and creating an online platform for national stakeholders and NHS organisations to highlight their work and promote their value. So we'd love for you to get involved as much as possible during this week. So you can follow NHS employers on social media and by using hashtag SASWeek23 in any content. So just once again, thank you to the GMC, thank you to James and Dean, and thank you all for your time today.